embed literature and creative writing as a means of teaching empathy. So to give a little bit of background about the Stoneygate Centre, it's been established to really think about the way we can embed empathic skills in clinical care and training. And I'm just going to ask my colleague, Dr. Rachel Winter, if she wouldn't mind saying a couple of words about what we're trying to do with this teaching.
Hi, thank you, Felicity. Yes, so I am a psychiatrist, but also an associate professor in empathic healthcare and medical education at the Centre for Empathic Healthcare. And the centre was established in 2022 following some work with our foundation year, or our year zero medical school year, which was set up in 2017. And had an empathy-focused curriculum. And I think later on in the presentation, we'll talk a little bit more about the foundation year students. But the success of the foundation year and specifically the empathy focus of the curriculum really drove the development of a funding proposal for the centre and established what we now have as the centre as a means to really focus what we were doing with the foundation year into a much wider audience. So thinking about how we can take what we've learned and apply it to the standard medical curriculum at Leicester Medical School, and then expand into other allied healthcare and nursing degrees and into postgraduate training. And as Felicity's alluded to, we're very creative anyway in what we do, but this is a particular creative health and creative writing aspect to see if we can identify ways to enhance empathy in our future workforce, our future medical workforce, through creative ways.
Great. Thank you, Rachel. So yes, we've been trialing different approaches, and you can see on the slide here, here's a record of one of the things we were doing last year, an SSC, an optional unit, and these were fifth-year students who were thinking about creative empathy, and they're experimenting with artistic expression at the Attenborough Arts Centre. We also did creative writing. We're thinking about ways in which students might tap into their creativity and reflect on the creative process. And that's got two main aspects, really. We're thinking about how they can be empathic and compassionate practitioners. We're also thinking about how they might be, they might demonstrate self-empathy, how creativity can really support student and practitioner resilience. So that's an image from the SSC in 2024. We've done a little write-up about that and published it in the Polyphony, really trying to identify some of our creative approaches and really thinking about, we wrote it together with Marianne from Attenborough Arts and the students themselves, Lauren Gurr and Anna Hennessy, and that really reflected on how we'd all learned through the creative process, really thinking about enjoying creativity and taking pleasure in the act of creation. And we were also thinking, in a broader sense, about how we might employ different imaginative approaches to teaching empathy and supporting young doctors. And that's part of the wider remit at the Stoneygate Centre. So with that in mind, I want to jump straight in and think about how we might tap into the creative process ourselves. So part of this workshop will be reflecting on our own creative process, thinking about some beginning creative exercises. Don't worry, we won't be asking you to share these, but we will be asking you to reflect on the process. So what we want to think about here is how we nurture the creative process and how we think about maintaining our own curiosity, how we're really thinking about opening ourselves up to different approaches and different ways towards teaching empathy. So we're going to come back to that quotation but that's just giving us some context about this creative exercise we're going to do together. So thinking about that creative process, the idea of curiosity, the back of our minds, I want you to think for a moment about colour. So you'll have seen on that polyphony article and on the artwork that's in the background there, the importance of colour. So I would like you to just have a look around you in the room you're in, out of the window, or at the artwork on the slide. I'd like you to think about and identify a colour that you're drawn to and to write it down, please. Again, a moment of reassurance. We won't be asking you to share these written works. We'll just be thinking about using them for your own reflections. So I'd like you to take a moment, please, to write that down. And next, I would like you, please, to think of a few words that might describe that colour, just to generate those and to write those down too, please. Anything at all. The odder, the better. So you're really thinking about different paths to describing that colour. And next, I'd like you to think about sensory approaches to that colour. So we've identified it. Now I'd really like you to get to know it and think about it from different angles. So what does that colour feel like? What's its texture? Imagine you are holding it or touching it. What would you write down about what it actually feels like? So really thinking about exploring it, approaching it. What does it feel like? Just a few phrases or words to describe that. Think about stroking it. What does it feel like? What does it smell like? You've really got something in mind. You're approaching it from different angles. Anything that you can generate about what it actually smells like when you get up close to it. Is it something that you want to get up close to? Would you be willing to taste it? How does it taste? What sort of impressions are you getting from it? Does it remind you of any food, a childhood food? Keep writing, keep generating those phrases and ideas. I'd like you to really get into this exercise and think about tasting it. Thinking further about your colour. If it made a noise, what would it be? Really generate those phrases you're thinking about. The sillier, the better. What sort of imaginative engagement do you have with this colour? And finally, I'd like you to think about a name for this colour. Do we have any interesting names coming to mind? Again, you're just thinking about something out of the ordinary. We're thinking about a Christian name or any other, and channel your wild Farrow ball moments. Anything at all that you'd like to give it, to christen it. Okay, so I'm going to come out of that exercise and I'm just going to see if I can go to the chat and have a look. I'd like people to, please, note anything down in the chat that you'd like to share. But this isn't primarily a sharing exercise. We're just thinking about you reflecting on your own creative process. So we went through, first of all, identifying, looking, thinking about it. We thought about describing it in ways that you might be used to, verbal ways. But then we also thought about sensory approaches to the colour. And really trying to get into it from a number of different angles. Really thinking about imaginative approaches to it. And you might be thinking that this is a really silly exercise, that this isn't something that you're used to doing. You might be feeling self-conscious about your approach to it. But I'd like us to just go back to that Jodie Halpern comment and really think about what we're trying to do with this exercise. It's not just about what we know. It's about how we maintain our curiosity, how we tap in to that new and fresh idea or angle. And this is a process that poets and writers through the ages have gone through. Think about Samuel Taylor Coleridge trying to describe the precise colour of yellow in his notebooks and looking around and thinking, looking at the urine in his chamber pot and thinking, that's a very curious shade of yellow. I'll try to describe it in minute detail. Christina Rossetti thinking about how to describe the colour pink. What is pink, she writes. Gerald Manley Hopkins trying to describe dappled skies. So it's a technique that all sorts of poets and writers have used across history, and it's a technique that we think can help in maintaining curiosity and moving towards an imaginative approach. So that's just a small example of the ways in which we've been trying to try to get our students to look at the world afresh. We've been thinking about tapping into different forms of arts practice and the research on those. This has been a really helpful approach in thinking about arts-based practice, how students can really come to terms with uncertainty and ambiguity. This research article informed a recent workshop that I did with the course leader on the Masters for Midwifery and Leadership. We were thinking about a workshop that we could offer to her final year students. She wanted them to have a think about the ways in which they could come to terms with the uncertainties and challenges that they were going to face as they moved from being students to being professional practitioners. How, as they moved into their professional identity, they were going to deal with uncertainties and challenges. One answer we thought might be through an ongoing interest in creative research and creative practice. As Ruth Sanders says, where there's no definite answer, but rather the focus remains on the process. So thinking about that research and thinking about what specific course leaders or practitioners might want to encourage in their students, we've been putting together workshops that address particular challenges. So this one for the midwifery students was around creative empathy and different ways of approaching ambiguity and different challenges. I put it together with Lucy Bradley, the course leader, and we offered it earlier this year. We were thinking about generating ideas from images and photographs and also from looking at poetry together. We did a series of creative writing and art exercises with the student midwives. So just to give you a taster of it, we were looking at pictures by Chris Porsche, a paramedic photographer from his time working in Peterborough City and District Hospital. So we looked at pictures and we read poems together. This is an example of one that we were looking at together, Ultrasound by Rachel Richardson. And we use those to generate discussion, connection, and their own writing. So let's just take a moment before we go into the next exercise to have a look at that poem together, Ultrasound. And as I read it, I just want you to note anything that stands out to you, to think about imagery, sound, anything that you're curious about. Novel unbegun, half loaf rising, lighthouse northward, and anchor south. Lemon to grapefruit, you sleep, step sidewise, turn over, pop up, tongue in the mouth. So the students were at first a bit uncertain about approaching this. They didn't really know what to do with this piece of poetry. But as they went on and discussed it together and really thought about the kind of ideas that those images were prompting in them, they became more and more confident about their own readings of it and how they could use it. And they then produced their own versions, and we were really thinking about how we might use that poetry not simply as a means of appreciating language or an aesthetic experience. We were thinking about how it might foster empathic connection and be used as a starting point for discussions about personal growth, about self-expression. So that was one example of the ways in which we've been really trying to put our research into practice and embedding close reading and creative response into clinical teaching. So just building on that, I'd like us to do an exercise that that borrows something from that workshop, and it also borrows something from a really well-known creative writing technique, but it's trying to put it together with what the Stoneygate Centre for Empathic Healthcare is doing more broadly. So we were thinking about the capacity of poetry to spark empathic connection and help us take on different perspectives. I'd like us to just have a go at a perspective taking exercise using this photograph. Again, it's one of Chris Porsche's photographs from 1982, and it shows Alan Lehman in Peterborough District Hospital with two curiously unnamed nursing staff looking on. I would like us to take a few minutes, please. Let's just see how we're doing for time. Let's take 3 minutes, please, to describe this scene. I'd like you to take on a third person perspective for this description. So you're just describing it very neutrally. I want you to note down any details which stand out. Again, this is just for you. There's no pressure to share this, although if you'd like to put it in the chat, you're very welcome to do so. But you're just describing the scene in the third person, noting down anything that stands out, really taking a good close look. So it's 12:51. Let's just take 3 minutes now to write down any details that stand out to you about that scene. Okay, so just take a minute more, please. All right. So we've got some comments in the got some comments coming through in the chat, which is great. We've got the hands touching the paper, gripping the sink. Yes, great comment there about there's something going wrong here. The nurse on the right looks defensive. The nurse in the middle looks unhappy. No eye contact. What's on that paper? Has something gone wrong? What else have we got? The untidy cupboards. Yes, everything really packed in there. And orange barley water. Yes, it's such a 1980s photo, isn't it? The students were taken aback by the uniforms that that the nurses are wearing. And the room looks both organised and crowded. Yes, there's a real sense of tension of an untold story going on there. So really good comments, lovely details there. And the more you look at that scene, I think that the odder it looks. But what I'd like us to do now, keep those details in your mind, really thinking about the whole scene and those untold stories that might be lurking there. And I'd like us to rewrite your scene, please, from the perspective of one of those people or one of the items in the picture. So let's give us 4 minutes. And so, or 5 minutes. Let's give a whole 5 minutes. Really get into this, I think. And we're starting at 12:57. Let's take 5 minutes to really consider. Again, you don't have to share this. This can just be your own writing. So we're starting to rewrite that scene from the perspective of one of the people or items in the picture. Okay, we've got another minute left. Okay, so that is 5 minutes. Just take a moment to look back through what you've written. And it would be great if people could share. If you want to share in the chat anything that you've written, that would be great. Or simply the perspectives that you wrote from. It would be great to know the different perspectives that people have adopted. So when I've done this, in the past we haven't, this is the first time we've used this picture, but in the past I've had some great student perspectives from the point of view of a carpet, a table, a cat, as well as really taking on the different people within the scene. So people have come up with really wonderful different takes on it. So Andy, would you like to read? Would you like to read yours out, Andy? I'm just picking on you there.
I've got it, of course. I'm sharing with Rachel. So this is the nurse to the far right of the picture near the sink. I know it's the doctor's fault, and he'll do his best to pass the blame on to the nursing team. He always does. Who's going to support me if I challenge him? I'll just bite my lip and humour him. We nurses need to stick together. We'll get our own back on him one day.
And I can really see that in the voice of that nurse, that her whole attitude there. It's really in keeping with her perspective, I think. And I love these Shreya's perspective on it as well, from the perspective of the tap. Drip, drip, no one is paying attention to me. The silent ways in which I'm losing water. I love that sense of the untold stories that are in this room. Will someone turn me off? I love that, Shreya. We've got this real sense of all these untold stories packed in to that scene, like all that linen that's squashed in the cupboards. So that's an example of a creative writing exercise that is really well known. It's very often practiced in creative writing workshops, and we think it needs to be brought in to different settings, that it's something that really works alongside the different ways in which different perspectives, patient stories, different angles on a scene are being highlighted through the Stoneygate Centre's work. So we're really thinking about both the creative process and more broadly how that creative process can help encourage empathic identification and connection. So thank you all for gamely taking part in that perspective taking exercise, and just to set it in a broader research context, we're thinking about what we can take, all the different aspects that we can take and learn from in terms of storytelling, creative writing, narrative medicine. So just to cite the authority in the area of narrative medicine, Rita Sharon. Quotes like this have been really influential in how we've tried to shape our creative approach. And she writes, rigorous training in the act of close reading and disciplined coaching in the craft of creative writing are powerful avenues to achieving perception. Creative training in clinical education doesn't have to start with writing about clinical matters. Instead, early on, learners must develop their creative and imaginative powers of discovery, vision, and representation. So that's central to the approach that we're trying to adopt. And just to follow up on that aspect of early on, we think this starts as soon as the students come to us. So when they start in on the foundation year. And just to give a little bit more information about what we're trying to do with the foundation year students. So these are students who come to us before they start on their medical degree, and they spend a year thinking about the skills that they're going to have to acquire. And we think alongside that, they need to have training in the act of close reading and writing creatively. So we've been doing empathy workshops, which have an aspect of creative writing and perspective taking within them. Just this year, this semester, we've begun experimenting with a book club for the foundation year students. And the book that we've chosen is Benji Waterhouse's memoir, You Don't Have to Be Mad to Work Here, A Psychiatrist's Life, which is at once a memoir and a perspective on different patients' stories. So he presents different narratives, but within that is the narrative of his own life and how he tries to maintain perspective as he goes from his training and his theoretical learning through to working on the wards and actually encountering different forms of challenging situations, and has his empathy that he's so carefully cultivated during training severely tested. So this is the book that we've been reading over the course of a whole semester. And we've really been thinking about ways in which we can encourage the students to learn from the book and learn from the reading process. Maintaining that curiosity and space for leisure reading and for sharing their reading together. And we've also been thinking about close reading, how they can really direct their attention to the book, spend time with particular passages, just like we were spending time with that picture, and really finding our way into it, looking and thinking about all the tiny details. That's what we've been trying to do over the course of a whole semester with the book. Students are in tutor groups. Each week, we asked each tutor group to present on a passage from the book, and we gradually worked our way through the entire text. And the students took it really seriously. Each week they presented particular passages. So they gave us an overview of their section. They talked about the patients that they encountered, and they asked the rest, all their peers, to read a particular section, and we went through it in detail. And we thought that really helped them connect with one another. We thought it helped them improve their presentation skills, and we thought it deeply embedded the idea of how they might read together. So we'd really recommend both the book and that technique for getting them thinking about how close reading can be used, and how empathic approaches can be embedded. So let's just have a look at a tiny extract from Benji Waterhouse, which is a passage from the very start of the book, where he is just preparing to go on the wards, and he's hearing his older trainer, Dr. Lang, and Keith giving Keith, who's a kind of police officer, security figure, who's been brought in to give them training on how they should respond to violent patients. And there's a whole setup about the ways in which they might manage their interactions with patients. Don't give them a hot cup of tea, for instance. Dr. Lang notices the startled looks on our faces as we all imagine a steaming hot tethies to the eyes, and steps in to reassure us. Such incidents are few and far between. Avoiding them is best practice. Simple things, like always sitting closest to the door so you have an escape route, and using the panic alarms, which will summon help immediately. Presuming the batteries haven't run out, adds Keith, ever the voice of doom. You could also use active listening skills, says Dr. Lang, completely ignoring Keith, which is where you give the impression that you're being very attentive and empathic. Let's practice demonstrating empathy, he suggests. Okay, says Keith, impatient to get on to the real business of practicing fighting patients. Can I get 2 volunteers? You can just see from that extract that Benji Waterhouse has had his apprenticeship in stand-up comedy as well as psychiatry, and he sets up his scenes so carefully, so we're really able to both sympathise and be amused by them. And this was one of the passages that the students picked out as telling them something about empathy. So the trainees here are practicing demonstrating empathy, practicing giving the impression that you're being very attentive and empathic. That led to a really interesting discussion about how deeply empathy could be embedded in a doctor's practice. And what was noticeable among the foundation year students was that they were also committed to the idea of being an empathic practitioner. And we want to keep that going through the foundation year and beyond. Rachel, I don't know whether I could come back to you to say a little bit about the foundation year and how it was set up and what we think the students are getting out of it.
Yes, of course. So the foundation year set up with a very generous gift, a philanthropic gift from the Stoneygate Trust in 2016-17 for students from a widening participation background, so less advantaged. And with a lower tariff, so they generally have an offer of 3 Bs or slightly lower occasionally, but with the potential to study medicine and from East Midlands, so generally students in East Midlands. And the foundation year has now grown in a number of places and has more national places too. But the key focus, as I mentioned earlier, of the foundation year was that it would have this empathy focused curriculum, and my role in developing that curriculum and teaching it and evaluating it was to look as part of the research at the impact that this curriculum had on student empathy development and how students had experienced the curriculum. And one of the most interesting findings that we did some research looking at a kind of 5 years worth of data and focus groups with students who had gone through the foundation year and then completed their first, second, third year at medical school. And we did focus groups with 4th and 5th year students, reflecting back on the foundation year and specifically the empathy curriculum. And obviously they hadn't had an opportunity to do your book club, Felicity, and engage in this particular exercise. But other exercises had been part of their training, which had borrowed from narrative medicine in various ways, along with lots of other kind of empathy-focused communication skills training, some active listening training, and communication skills in terms of verbal and non-verbal skills too, but lots of opportunities to meet with patients and to listen to their stories and interpret them in different ways. And what was really fascinating from these foundation students who were now 4th, 5th year students was that they really talked about how empathy was a part of their professional development. It's part of their professional identity. So they didn't see empathy as a clinical skill that they would have to practice and pick up and use, like practicing examining someone's knee or thinking about history taking. It was just something that they embedded in their own practice day in, day out. So it was part of how they communicated with patients. And there were some lovely comments from students talking about how they supported their peers who weren't foundation year students but had come through the standard course, and their peers would often say, I've got my OSCE coming up and I must remember to be empathic and I must remember to wash my hands. And the foundation students would think, well, I don't need to worry about what I'm going to say. I know that whatever I say will be empathic because I am empathic. And that was a real lovely finding, I think, from the foundation year students, that there's identity rooted in empathy as a result of the training that they had, rather than just a skill that they could use when needed.
Yeah. So that's what we're really trying to encourage, to maintain, to nurture, and we're thinking about different ways in which we can teach empathy. So thinking about creative response, imaginative exercises, and all sorts of everyday creative activities that can become a part of a student's repertoire or can become embedded into their everyday practice is a part of that. So just in closing, I'd like us just to build on that, to really think about different forms of creative practice. We've covered some of the modes that we're experimenting in over the course of this webinar. We've been thinking about the SSC and the ways in which we encourage students to really engage in different creative activities. We've been thinking about particular creative exercises and using creative writing as a mode of tapping into that. And we've been thinking about close reading and our book club and trying to get students to engage with reading as a part of their empathic professional identity. But I'd like us to close just by thinking about next steps, really. I'd like us to take a few minutes, please, to note and to write in the chat if you feel that you're able to do so. Any ideas about your own creative practice? Anything that you do that you feel allows you to access the creative process in your own life, whether that's reading, crochet, singing, art, anything that you already do, and something that you would like to do in the future. What creative activity would you like to try? And we're constantly thinking about ways in which we might fold in different experiences, different modes of creative practice. So I'd love, in closing, to just have some ideas put in the chat, please. And I'm just going to stop sharing my my screen for the moment. And I'm going to ask people, if they don't mind, to just put any ideas down in the chat. So thanks, Rachel, coming in there straight away with attend a creative writing course. Brilliant idea. I love the fact that in the back of his book, Benji Waterhouse talks about the importance of going along to a creative writing course and of attending a communal storytelling night and curating that. So I think that's a great idea. Shreya says bibliotherapy, reading together as a form of community building. Book clubs, yes, that experience of shared reading. Andy says learn a musical instrument. I think these are all such good ideas of really thinking. I'd like people just to take that time to reflect on your own creative practice, even if you don't want to share it with us, just to reflect on anything that you'd like to do to bring more creativity and the creative process into your life. Shreya says, integrating mindfulness into daily life. Aditi says, learn to read in a new language. Take an art class. And just to reiterate that one of the aspects we looked at the SSC was encouraging the students to use the Attenborough Arts Centre, visit that, think about the exhibitions, take a life drawing class, really think about their own art practice. And Rachel's got a great suggestion in the chat that Benji Waterhouse is actually on his book tour. He is coming to talk to the medical students, and then on Saturday, the 10th of May, he's actually starting his book tour. And we think it's an excellent involving book as well as a good teaching tool. So I'd second that recommendation of going along. Cleo says, read more poetry. Yes. And if anybody would like that poetry guide and reading list that we did with the midwifery students, I'd be very glad to pass that on. All in writes drawing, Batunde writes photography. Megan says, learn about creative writing as trauma therapy and how to teach that ethically. What a great suggestion. Drawing and art classes, sculpture classes, says Andy. Yes, so a lovely portfolio of different creative ideas. So just to add to this, I will just close by sharing our next lunchtime learning session that's coming up. And that is Cleo, and that she's talking about Beyond the Tick Box, the real impact of intersectionality on patient care. And that's on Thursday, the 1st of May. So all the lunchtime learning sessions will be monthly. And that's online again. So do sign up for that. Booking is open now. And just to give it...
Felicity, we can't see the slide. I don't know if you've...
I'm sorry. Let me just... try and share that again.
Yeah, perfect.
And I'll just go to the... So that's the next learning event, and you can scan the QR code to find out more about that and book on. And just to give a shout out to our Global Empathy in Healthcare Network Symposium, and that is 15th and 16th of September. And I think booking for that is currently open. So thank you all very much. We'd like to just close by asking if there are any questions. You can put them in the chat or ask us. But thank you very much, everyone, for attending. Thank you, Andy. Abstracts for the symposium are open until 16th of April. Great. And I know there will be representation from creative practitioners as well as from a range of clinicians as well. Great. Thank you all, and we'll look forward to seeing you for the next Lunchtime Learning Seminar.